We direct your attention to the pitcher's mound for today's ceremonial first pitch. Please welcome Kevin Czapelski, a patient of Dr. David Altchek, the medical director for the New York Mets.
Well, I played a summer game in Staten Island, New York, and third pitch in, I just couldn't hold the ball anymore. Didn't hear no pop or anything, but I was most definitely concerned about it.
I determined that Kevin needed Tommy John surgery because he had had pain for quite a while in his throwing elbow. He was battling through it, continuing to pitch, and then the late summer of 2013, he had a sudden increase in his pain. We got an MRI here at HSS, and it showed that he had a significant tear of his ulnar collateral ligament, as well as a spur in the back of the elbow. The only solution for this combination of severe injuries is Tommy John surgery. MRIs of the elbow are surprisingly difficult to do. The anatomy of the elbow is not that big, and Dr. Potter here, our chief of radiology, has done a fabulous job over the years of working with me to get us unbelievably clear images. If you can imagine when you were 15, if you went to a doctor and the thing you loved to do most, you were told you had this severe injury, you needed surgery, and then you wouldn't be able to play for a year. And you can imagine how hard is it when you're 15 to be patient. Kevin did everything great. He did the actual rehab. He was patient. He was mature way beyond his years, and he got a great outcome.
Just had a great experience with him, and he did a great job on my elbow.
The rehab takes a year, so it's obviously very important. The surgery takes 35 to 40 minutes. The rehab takes a year. The rehab is very precise and not that common. So we're blessed here at Special Surgery to have Mickey Levinson, who's the head of our throwing athlete rehab section.
Once it comes out of the brace at 5 weeks, we usually begin a formal rehabilitation, which we have a set guidelines for here at the hospital that we can give to other therapists who may be not so familiar with that surgery.
Mickey's also another great guy. He brought me through therapy like no problem. He would always be there behind my back, and he would text me from day to day, just seeing how I'm doing and keeping up with therapy.
It's a good feeling when they do get off the mound and they call and they say, look, I pitched in a game, or I pitched well in a game.
Right now I feel back to normal. It feels like I never had surgery once. I feel great and I feel strong. Dr. Altchek called my dad up say that the Mets need somebody for the event to throw out the first pitch, and it's a dream come true.
Kevin, are you ready? It's your pitch. Ladies and gentlemen, Kevin Czapelski.